Well, renal sonography is a very unusual topic in that although for ultrasound it's very easy to see the kidneys, in fact, renal lesions are commonly missed because they're very difficult to spot. And so, like this cheetah, it's very important that an imager, as they're looking at the kidneys, looks at them very, very carefully in order not to miss lesions. Well, why do we miss lesions in the kidney? Well, I'm going to divide this talk into 4 different topics because these are the major reasons why we're missing lesions, and they include sonographer training issues, non-visualization of kidney lesions, pitfalls in hydronephrosis, and then the pitfalls we see in imaging renal masses. Sonographer training issues are a critical part of the reason why we miss, frankly, any kind of abnormality in the abdomen. And some of the reasons are that the sonographer is inexperienced. In other words, they're a kind of imager in that they see but don't observe. So they just take pictures instead of actually taking pictures which are diagnostic. And in doing so, they may miss lesions. And if they miss lesions, then you as a radiologist will also miss these lesions. It's therefore very important that your sonographers are well versed in renal abnormalities and can spot these abnormalities readily. Well, the normal appearance of the kidney is generally something that all sonographers and all radiologists are very well familiar with. That is, it's a reniform object, it's between 10 to 14 centimeters in length. The kidney should be symmetric in size with medium echogenicity and a cortex greater than or equal to 10 millimeters. So how do we make errors in appearance? Well, sometimes the kidneys are normal appearing to us, but in fact they're really abnormal. And the reasons why we miss this abnormality are, first of all, if the size of the kidneys is abnormal and yet measurements are not present, or we don't remeasure the lesion. And so when we're looking at the kidneys, it's very important that your sonographers have either made measurements or that you are very aware of what the estimated length of each kidney is in order not to miss an abnormality due to renal size. We also miss renal abnormalities because there are standard renal pictures which are just omitted from the actual exam. And so, for example, if you have an abdominal ultrasound and you're missing the picture of the right kidney with respect to the liver, you may not realize that the echogenicity of that kidney is in fact abnormal. Abnormal orientation is a more difficult problem to miss because unless you're actually scanning the kidney, you may not realize that the kidneys are abnormal in orientation. And so it's important that if you are not directly scanning the patient, that you are aware of what that orientation is by your sonographer. And then finally, it's very important that whenever you see the kidneys in an image, you're able to see all the borders of each kidney. Well, here's an example of a 36-year-old woman with pelvic pain, and this is the right kidney. And is it normal? Well, in fact, it's too large. It measures 15.3 centimeters in length, and this woman only has one kidney. So it's very important in this case to have had that measurement so that if you don't see the left side, you have a good reason as to why you're missing that left kidney. Here's a 70-year-old man with bacteremia, and the reason he came to us was to rule out gallstones. My sonographer said that the exam was normal, but as I was looking at the exam, I thought that the echogenicity of the kidney was abnormal compared to the liver. And so I called that and later on reviewed the patient's chart and found that in fact this patient did have an elevated creatinine. Here's another case, 44-year-old woman with possible hydronephrosis. Well, if you look at these kidneys, there's no hydronephrosis, but do you see any other abnormality? In the right kidney, you might say, well, maybe there's a cystic lesion here. In fact, there's another important problem with both kidney images, and that is that you don't see the lower poles. And so one of the critical aspects of a kidney examination is that you see every single border, and in fact, this kidney was a horseshoe kidney. And what that sonographer didn't tell you was that the orientation of both kidneys was abnormal. And so the lower poles aren't seen because she originally missed the fact that they were connected to each other. Now, sometimes the sonographer will come to you and say, I don't see one of the kidneys. And when this happens, it's very important to have some kind of differential in your mind in order to problem solve why you may not be seeing that kidney. And so possibilities include the fact that perhaps the sonographer is using poor technique, or the patient's just difficult to scan. Another reason may be that there's a congenital abnormality here, so that, for example, the patient has agenesis of the kidney. Sometimes the lack of a kidney is acquired. For example, if the patient's had a nephrectomy and your sonographer hasn't asked the patient if the patient's had surgery. If the kidney is echogenic, if the patient has renal disease, then the kidneys may be extremely echogenic and small and therefore blend into the retroperitoneum. In that case, it may be very difficult to see either kidney in this situation. And then finally, if you're not able to see a kidney, it's very critical that you look all over the abdomen to make sure that you're not missing a kidney that's in an abnormal location. Okay, so how do you go about doing this kind of problem-solving technique as you're actually doing your exam? Well, first of all, as I stated, when you're told that there's no kidney visible, the first thing to think about is it technique? So when you look at your images, one of the things you can evaluate is, does it look like there's too much air or gas? Or you ask your sonographer, why don't you see the kidney? And they may just say, well, gee, there's overlying gas. Well, in that case, one of the suggestions you may use is to have the patient lie on their stomach, because using a posterior approach, you can almost always see a kidney. The second technique is to make sure you're looking at the contralateral kidney very carefully and see it and see if you can tell why it is that the other kidney is missing. Because this contralateral kidney that you see commonly has clues to the missing kidney. First of all, is the contralateral visualized kidney large? If so, then you can anticipate that the other kidney, the one you're not seeing, may be very small, atrophic, or may be missing. Could there be a congenital abnormality? That's very important to think about. Is the kidney, for example, a cross-fused ectopia, the kidneys would be on the same side. And then finally, if the contralateral kidney, the one you visualize, appears very normal, then look for a kidney that's perhaps in the wrong location. Well, as you're doing your problem solving and looking for kidneys that are in locations other than in the upper quadrants, the pelvis is probably the first place to look. And when you're looking in the pelvis, it's important to put a lot of pressure against the pelvic brim. When you do this, you can generally push away any air and see a kidney against the pelvic brim. In the female pelvis, sometimes you can see associated gynecologic abnormalities, and that will give you a clue as to why you're not seeing the kidney, because congenital abnormalities in the pelvis in a female are commonly associated with congenital problems in the kidneys. And then finally, look at the renal arteries. Sometimes the renal artery on the non-visualized side will give you a clue as to the location of the non-visualized kidney. Well, here's a patient who came in had a stent previously and for UPJ obstruction, but now has urosepsis. And the sonographer came up to the radiologist and said, gee, I'm not sure, but this is the only thing I see in the left upper quadrant. I'm really not sure it's the kidney. And if you look at it, it looks like it perhaps is reniform, but it's very, very difficult to see. So is this a technique problem? Well, in this particular case, it's not a technique problem because this patient has emphysematous pyelonephritis. Here you see a plain film where there's a large amount of air which has infiltrated the entire kidney, and a CT scan emphasizing the same findings. With this air interspersed throughout the kidney, then it makes the ultrasound image of the kidney very distorted. Here's another man, 48-year-old with elevated creatinine. He doesn't have a kidney which is visualized. His left kidney looks normal, however. So what should we be thinking about? Well, normal appearing kidney on the visualized side, again, think about a contralateral non-visualized kidney in a wrong location. And that's where it is in this case. In this case, it was deep in the pelvis. In fact, it was a transverse kidney. Here you see here with the great vessels deep to them, to the kidney, and this kidney had 2 renal arteries.